Richard, you have gone to the trouble to write a very interesting blog about the need to improve dental services for head and neck cancer patients. So can you just tell us in a nutshell what has angered you and distressed you so much about getting the dental care you need for your head and neck cancer patients that you've gone into print?
There are lots of barriers to getting my patients seen and managed by dentists, and they start at the beginning of treatment and stretch through to after treatment. So I'm very lucky. Initially, when I see a patient, I'll have them assessed by the dentist at the hospital, who is very good. We'll see them on the same day that I see the patient, and then they'll advise me about whether they, particularly if we think they're definitely going to have radiotherapy, whether they need any teeth removed. Even a lot of the patients who don't need radiotherapy, a lot of my patients have bad teeth, and they need them removed anyway. So they advise me, and in fact, over the years, I've taught myself, and with the dentist, he's taught me how to remove teeth, because if they're not removed in a timely fashion, it really delays patients' treatment. And I find that really frustrating, because when I hear stories that a patient has, they get seen, they get told that they need to go to radiotherapy treatment, and then all of a sudden they've got to have teeth removed, but it takes a month for them to see a dentist, and then another week or two to get the teeth removed, and then they've got to let that heal up for a few weeks, and then they're going to start their radiotherapy. It's 2 months or 3 months down the track, and that's truly, for head and neck cancer, and for all cancers, it's unacceptable to have to wait so long to progress onto treatment. So I find that hugely frustrating, and that's why I have actually learnt how to remove teeth myself, and that avoids that being a problem, to be honest. And then there are the problems that we strike immediately. There may be problems during treatment, but really it's in that period of time after treatment. These poor patients, we've removed their teeth, they've got, their mouths are sore, it eventually settles down, they may need dentures. It's incredibly difficult to get a set of dentures into a patient. They have to settle down after treatment, but it's also the problem of getting them done for public patients. Getting them to get dentures fitted is incredibly frustrating. I have somebody that I can send to, but in general, it's really hard to do. And patients have ongoing problems with their mouth and with their teeth. And to get them to see a dentist is difficult. They can see a dentist privately, but a lot of our patients can't afford to do that. You're lucky you're able to afford to see, you can see a dentist, I can see a dentist, but a lot of the patients really can't afford to see a dentist. And then to stand in a line at the dental hospital or somewhere like that, where in fact they may not get looked after, they may be on a big long waiting list, is problematic. And then I think really the other thing is that it's really the long term. It's about, what happens through the years, because we know that if you've had radiotherapy treatment, or not just radiotherapy, treatment maybe from surgery where the mouth dries out and salivary flow decreases, we know that impacts on your dental health, and it leads to decay, and it leads to teeth falling to bits. And it's incredibly difficult to get patients seen, to get them managed. Again, that is really frustrating, and I think upsetting for patients and embarrassing for patients.
You care too. I can hear it in your voice. I will be recommending to everyone who's watching this to look at your blog, and we'll have a link to your written blog, which puts out a lot of ideas in a very orderly fashion. But in a nutshell, what is an action, a change to the system that could bring some immediate positive benefit to the head and neck cancer patients who you're dealing with on a daily basis? I'm talking to you today from rural New South Wales. You're in the city as well. What action would help?
The one thing that would really make a huge difference to our patients is if the government and Medicare gave the ability to selected surgeons who treat head and neck cancer patients to be able to refer them on to dentists so that they can get some free dental care. At the present time, and it's in the blog, it makes it clear, it's a very convoluted system, and it does vary from state to state. It may be that I have to send a patient back to a GP and get them to do a plan to get a patient referred on to see a dentist. But 25% of my patients, maybe more, don't have a GP. So they can't even do that. So it's very frustrating. So if I could change something, it would be, please ask the health department, allow some of the surgeons who look after patients with these problems to be able to do direct referrals into the system to dentists and do care plans.
Look, thank you so much, Richard. And as I say, there is a link to the blog which outlines a whole lot more about Richard's thinking based on his many years of experience, really working these days almost full time with head and neck cancer patients. That's right, isn't it?
Yes, it is. That's essentially all I do. I'm down here in Griffith today and I've seen 15 of my patients who are from down around this area. So, yes.
Well, I just want to thank you on behalf of country people. Thank you for travelling to rural New South Wales, as well as being at St Vincent's public and private in the Kinghorn in Darlinghurst in Sydney. Richard, thank you so much.
Thanks, Julie. Thanks, Amelia.